If you enjoy soap operas, then you probably know exactly who Dr. Milena Evans is. She's played by actress Deidre Hall on Days of Our Lives. Deidre has become a big fan of vision care, due in large part to something that happened to her mother. I spoke earlier with Deidre and a real-life doctor about taking care of your eyesight, courtesy of Regeneron Pharmaceuticals and the American Academy of Ophthalmology. Deidre Hall from Days of Our Lives and Dr. Matthew McCumber from the American Academy of Ophthalmology and the American Society of Retina Specialists. Guys, thank you so much for talking with us today.
Thanks, Danny. It's so nice to be with you. Thank you.
Thanks, Danny.
Deidre, let's talk a little bit about your mom and the vision problems that she had later in life. What happened with her?
My mother was diagnosed with macular later in life, and to that point she had been a very active, involved. She loved bridge, she loved reading, she loved to knit. All those things required good vision, and because she was diagnosed so early on, there wasn't much hope for her. So we had to sort of suffer along with her and watch her gradually be robbed of the things she loved doing most in her retirement years. We know that AMD is a hereditary-based disease, so obviously what I want your audience to know is that if you have a family member or anybody close to you that's been diagnosed, you're also in line for it. So be especially cautious about getting your eye care professional on board.
Dr. McCumber, tell us exactly what is AMD and how do we look for it? What are the things that we need to be on the lookout for?
So age-related macular degeneration, or AMD, is a leading cause of vision loss in the United States. It's age-related, so it affects individuals over age 50. It's a problem in the central retina. At first, there may be no symptoms, just a little trouble reading small print, need a stronger reading light, but as it progresses, it can affect the center, develop into something called wet AMD, where abnormal blood vessels grow under the retina in the eye. That can cause distortion, blurred vision. People can no longer see to read, recognize faces, drive, and that's where we really want to stress that patients get in to see their ophthalmologist, or a specialized ophthalmologist in particular, a retina specialist, who can provide excellent treatment, medications we can give to the eye. Unfortunately, they weren't available when Deidre's mom developed this disease, but we have them now, and so if we treat it early, we can prevent vision loss or even restore vision in many cases.
Now, Deidre, what are you doing to take care of your eyesight? Do you have a routine, or are there certain products you use? How does that work for you?
Well, there are products per se, but I certainly follow the guidelines that we know about already, which is I quit smoking 30 years ago because I'm conscious. I eat a balanced diet, I exercise regularly, and I make sure that I see my eye care professional.
And where can our viewers go to find out more about AMD?
We've got a wonderful guidebook, Danny, that's available to your viewers free of cost, and it includes a DVD if you go to our website, which is geteyesmart.org, and that's I-E-Y-E, smart.org.
Gotcha. Dr. McCumber, regular eye exams, people are used to getting those, but with AMD, is this something that you have to specifically ask your optometrist or your doctor to look at for specifically, or is this something that they automatically do?
Well, they should automatically do that on a dilated eye exam, particularly starting at age 40. However, if you have a family member who has AMD, make sure they're aware of that, so they will have a higher degree of sensitivity. Perhaps they would want to have you come in more frequently than otherwise, even yearly in particular, if you have early signs of AMD.
All right, super. Guys, we're out of time, but thanks so much for chatting with us today. Best of luck with you.
Thanks, Danny.
Thank you, Danny.